It's not as if we are not in this country unable to get jabs into arms. It's the bit we've got absolutely right. It's the bit that we continue, it seems, to get right. So anybody who wants a jab is very likely going to be able to get one if they've not been offered already very, very shortly indeed. There's no shortage of these jabs. Why would care home workers not want to be vaccinated, though? Science has, as far as I can see, and I sit here as someone who had my second jab on Thursday, so I'm not advocating one thing for someone else without following, what I'm saying for myself. I was very keen to be vaccinated. I've now had both jabs. What would be the reason for not wanting one? Science has provided a way out of this miserable 18 months that we've been in. Vaccination is going to be the thing that gets us out. It is the thing that's getting us out. Why, particularly if somebody is working in a care home setting, would they not want to take advantage of this? 0345 6060 973. A question about compulsion as well, of course. And Tony Stein is Chief Executive of Healthcare Management Solutions, operating around 80 care homes across the UK. Tony, thank you for your time this morning. We've now got the EHRC, the Equality and Human Rights Commission, saying that the idea of making these COVID jabs compulsory for care home staff, they don't think that's incompatible with the concept of individual rights as they see it. What do you think?
Well, I suppose the way we look at it, and we've looked at it like this all the way right from the very beginning of this debate, is that we'd rather not mandate that people did things that they originally never envisaged when they joined us. When we first recruited these people, it wasn't a necessity, and to force them to do it now seems to me it's preferable not to have to do that. I think the reality is what we've done is we've been providing information and assurances to people. We've been signposting them to credible sources of information about vaccine safety, encouraging them to understand how being vaccinated helps to protect not just the residents, but the people around them, their fellow workers and so on. And actually, we've been really successful. We've got 82% of our workforce of about 2,500 have volunteered to be vaccinated. So we've had a really strong success rate with that, adopting that policy.
Well, that feels like
really, really good.
It feels like an increase, because last time we spoke about this, perhaps some weeks, maybe even months ago, those numbers were not at 82%. So your contention is that the process of persuasion and education has been and is being successful.
Yeah, definitely. And it's something that we've done, we've continued with, and we will continue with. I think it's important. You've got to understand that some people are genuinely worried about this. And I think taking the step of forcing people to do it demonstrates you're a certain kind of employer, and I think that worries them as well. So you've got to try and point them to making their own decisions. Clearly, if the regulations change, then we'll have to take a different view, and we'll follow the guidelines. What we have said, and we've said this all along, is that when we recruit new staff, we'll make that a condition of their employment. And it's very different, because at that point, then they've got a choice, haven't they? They'll come and join us if they feel they've got to be vaccinated, and they're happy with that.
Yes, although theoretically there's a wrinkle there as well, isn't there? Because if someone feels that they aren't being considered for a job in a way that makes them feel they're being discriminated against, you can imagine someone raising the same objection.
I guess so. I mean, it's not a discriminatory thing. It's a condition of employment in the same way that. But
it's one that doesn't exist now, is the point I'm making.
Yeah. No, I agree with that. But I think it's a reasonable thing to request, given that the evidence is increasingly pointing to the fact that you're less contagious if you've been vaccinated.
And that is why the Equality and Human Rights Commission have judged that ministers, if they do go ahead with this change, are, quote, right to prioritise protection of the right to life for residents and staff. They say it would be reasonable for care home workers to need a jab in order to work directly with older and disabled people, subject to some important safeguards. So it strikes me that you either make this compulsory for all current and future healthcare workers, or you don't. It seems like a strange pivot point or a strange splitting point to say not for current workers but for future workers.
It may be a little bit unusual, but I think, as I say, you can offer encouragement and advice, and it seems to me that people genuinely are taking us up on that. Again, I take the view that when we recruited the people who are working for us, it wasn't a condition, and they joined us on that basis. Now we're offering people the choice to join us if they're prepared to be vaccinated, and so they don't need to make that choice. So I think it's a good way of dealing with it, personally, I think.
The level of reluctance or hesitancy is plainly falling, and that's an excellent thing, but it isn't falling to zero. Why are people, particularly those who work with elderly and vulnerable people, why are they, in any numbers, still reluctant to be vaccinated?
There's a huge amount of misinformation out there that you've got to fight your way through. If you look on social media particularly, there's a lot of stuff being peddled that, is frankly either made up or genuinely just wrong. But I think if you think back to the time, we've got a lot of very young female workers, for example, and it's not that long ago that was very heavily pushed around on social media that this impacted fertility. And whether that's right or wrong, you can't blame people for having a concern. My view is, I think there's evidence coming out all the time, more and more information's coming out to say that's not the case. And in fact, actually, as people progress, as we go through the vaccination program, people can see those around them that have been vaccinated. Yeah. They might have had mild symptoms, but they're better now. So, I think they're getting more confident with it.
I had my second jab last Thursday. I couldn't wait for that to get into my arm. I simply don't understand vaccine hesitancy. I don't understand the skepticism. I just don't understand why somebody would not want to be vaccinated. But we are where we are. I wonder whether you could answer this, because there is still some doubt expressed, particularly now that vaccines have protected the most vulnerable. If a care worker says, I don't need to be vaccinated because I will be surrounded by people who have already been fully vaccinated, I present no risk to them and they present no risk to me. How do you answer that?
No, it's completely wrong. I mean, the reality is that no vaccine is 100% safe, so you don't get 100% protection. It will improve your levels of protection. And we also now have increasing evidence to show that people who are vaccinated are less likely to be contagious, in the sense that the viral load that they carry is going to be lower. So whilst we would recognise that there will be less risk to have, say, 80% of the people in the care service vaccinated and all of our residents vaccinated, it's not a nil risk.
Yeah. But this is part of the problem, isn't it? Because people will hear conversations like this, and you're absolutely correct that the vaccine it doesn't provide 100% protection. It doesn't work all of the time. But someone will hear this and think, well, I just heard that it doesn't work. I've heard that it's not foolproof, and therefore there's no point taking it. That's part of the issue here, isn't it? That skeptics, they're not big on nuance.
No, they're not. And I think, you and I and others, many others will say, there's a sort of civic and social responsibility. It's a bit like MMR vaccination, isn't it? There are those who will be sceptical about that, and they won't have their kids vaccinated, and they'll say, well, we get the herd immunity protection, so we'll let everybody else take the risk, and we won't.
But even with MMR, that can be traced back to one thoroughly debunked and entirely erroneous and hugely dangerous former scientist who spread provable, demonstrable lies about the MMR vaccine. And many years on, there is still hesitancy because of that one source of misinformation. So this is a big problem. It
is. I mean, you're saying, you've made the point, haven't you, that many years on, there's still some issues around that particular piece of work. We're still very fresh into this whole COVID issue, and that the stuff that's been peddled around, the misinformation that's been peddled around, is still around on social media. I receive letters from worried relatives about the vaccination program myself, and I don't understand it, and I think that's because people perhaps have listened to the wrong sources, and they've believed things on social media that frankly we don't believe, because we do a lot of, as you can imagine, as healthcare workers, we spend a lot of time looking at the research, but not everybody sees that, and I think it's all very easy to take the high road and say, well, we're intelligent, we've done the research, we understand, you don't. But it's also sensible, I think, at times to put yourself in other people's shoes and say, well, what they're exposed to and the information that they've had and what their friends are telling them, is telling them something different. If you just go around saying, I don't care what you believe and I don't care what you've read, we're going to stick this needle in your arm or you lose your job. I think I'd rather not do that. I'd rather we got them to a position where they understood why and they chose to do it.
With the 82% compliance that you contend, and hopefully that number will rise, is there a level, do you think, where if you get to 85, 90%, it doesn't matter actually at that point if the rest of the care home staff still refuse to be vaccinated? Yeah,
I think the government advice to us has been that if you can hit 80%, you'll achieve a good level of that herd immunity. We've taken a view that we will continue to provide that signposting, we'll continue to provide encouragement and advice, and we'll endeavour to get to the 100%. Of all those who can, have no medical reason for not having the vaccine.
Tony, thank you. Tony Stein, Chief Executive of Healthcare Management Solutions, which operates around 80 care homes across the UK.